Hi, Chairman, Chairperson. Um, my name is Tinpawee Thongkongthun. I'm from CICM from Thammasat University. I am here to present my topic about addressing the treatment gaps for severe Crohn's disease in Southeast Asia, which is a case of Infliximab-Associated sepsis. He's actually he's actually my patient at the university, so I found his case really interesting. That is why I'm here today to present this topic to you. So this case kind of want to highlight the challenges and limitations in treating the severe Crohn's disease in Thailand, which is particularly focusing on the use of like biologic treatment in the presence of occult infections. Severe Crohn's disease poses unique, sorry, okay. Severe Crohn's disease poses a unique challenges, especially in regions like Southeast Asia, because prevalence of these disease is really low and the treatment guidelines are really limited. The case discusses a 67-year-old man who's presented with chronic diarrhea, and he has underlying health conditions that is involved in the Crohn's disease involving a left colonic stricture, and the key focus is on his treatment course and complications and outcomes. The patient initially presented with intestinal symptoms such as diarrhea and bloody diarrhea, and was diagnosed with Crohn's disease later on. He was started on infliximab and azathioprine. However, after receiving his second dose of infliximab, he did not only get COVID-19 infection, but he was later also diagnosed with Listeria monocytogenes septicemia. Further hospital evaluation, when he was admitted, we found that he got PJP pneumonia and Serratia marescens pneumonia, alongside with bone marrow suppression due to sepsis. And due to these complications, infliximab was discontinued, and the patient transitioned to vedolizumab. Despite his improvements, his inflammatory markers remain elevated, and imaging shows an active lesions. The first picture on the left is where the patient's colonoscopy on the February of 2022, when the patient was first diagnosed with Crohn's disease at the terminal ileum. And figure B also show after 2 years, he's still after receiving the infliximab-induced sepsis, we can see that it's kind of worse. So here, I would like to discuss that the case highlights the critical need for a tailored IBD management in Southeast Asia, because when we were looking for other treatment other than infliximab, we could not find so. And the use of infliximab also require like antiviral prophylaxis due to the risk of HBV reactivation, because this patient also got HBV reactivation after. And furthermore, progressive disease and significant infections exposed this limitation in our treatment approach. So this finding want to emphasize on the importance of the region-specific treatment protocols, even though the numbers of populations are low, and also screening for like latent infections prior to biological studies, as well as individualize the treatment plans to improve the patient outcomes. So in conclusion, this case demonstrates the importance of proper preparation and individualized treatment plans to optimize the best outcomes for the patient in IBD in Thailand. Thank you.
I'm still unclear why a patient who received infliximab got sepsis because of it. Can you explain more a little bit about it?
Yeah, so the timeline is actually the first time he got budesonide, and then it was proven ineffective through the colonoscope, and then we switched to infliximab and azathioprine. And
Yeah, I got that timeline, but
okay.
I'm not quite sure about the mechanism behind that. And how did you rule out another cause that might
We
cause
understand that
sepsis in this patient?
Yeah. So we understand that the bone marrow suppression is due to azathioprine, but then there are like after we stop azathioprine for a bit, the patient were still continued by infliximab, and he then gets sepsis time over time. He got like 3 sepsis in total after we stop azathioprine and only continue with infliximab. So we think that infliximab could be directly the cause of this sepsis. So then we try other biological. Yeah.